Hi, I'm Evelyn Castle.
And I'm Adam Thompson.
Together, we're the founders and executive directors of eHealth Africa.
eHealth Africa was created with a simple idea, that people in Africa could have better healthcare if those providing health services were able to make data-driven decisions with accurate information.
Our belief that careful analysis of data could improve public health was formed while performing research at the University of California, Santa Cruz.
Once we started working in northern Nigeria, we implemented our solution by leveraging technology to allow for better decision-making.
We wanted to develop sharp and original ways to streamline health service delivery and emergency response through the integration of information, technology, and logistics.
After moving to Nigeria in 2010, we learned that clinics were overwhelmed by paper records, and there was little ability among staff to accurately track and report patient information.
We helped a family health center in Kaduna State, Nigeria, to move from paper to an electronic medical record system, or an EMR. Within the first year, staff were able to input 1,000 children's vaccination records, track and report their progress via the EMR.
The monthly data reports also allowed for better financial oversight, and even revealed that vaccine funds were being misappropriated.
In 2012, Nigeria was the only remaining polio endemic African country, and the number of new wild poliovirus cases were increasing. As part of the nation's response to this emergency, the Emergency Operations Centers, EOCs, were introduced as command centers for polio eradication partners to execute a coordinated response to polio. We first joined polio eradication efforts in Nigeria by building Nigeria's EOCs.
I've been working with eHealth Africa for 8 years. We started off with 8 polio emergency operations centers and then diversified into other projects like the Kano Connect, Endgame Strategy, and come 2020, we have been certified polio-free. I've learned a lot of things working with eHealth for this past 8 years. Every day is an adventure. Every day is a learning process. So if you work for eHealth Africa, you just don't work for working's sake. You are being developed mentally, emotionally, and technically. So to eHealth Africa, I say a big thank you for having me for all this while. And I look forward to many more conquerors like we conquered the polio.
We continued to support Nigeria's polio eradication efforts by mapping 11 northern states to support the microplanning of vaccination campaigns. As our work increased, we also expanded our footprint in the world to support our ability to deliver. The Berlin office opened and our global health informatics team grew. As we became more involved in Nigeria's polio eradication program, we observed several gaps in immunization service delivery. In addition to providing technology-based solutions, we also began to provide solutions to challenges in logistics and supply chain management. In late 2013, an Ebola virus disease outbreak started in Guinea. This outbreak was not detected until March 2014, when both Guinea and Liberia reported cases of the disease. By May 2014, Sierra Leone also reported its first case. On July 24, 2014, Nigeria reported its index case of the Ebola virus disease, setting off a chain of transmission that would include 19 other people and result in 7 deaths. Based on our experience in setting up the polio EOCs, eHealth Africa was invited to help the country respond to this new public health emergency.
During the Ebola outbreak, we were called by the Federal Ministry of Health and CDC to support on setting up an emergency operations center in Lagos. Our team was able to deploy within 24 to 48 hours, which made us one of the first responders in Lagos. Upon arriving in Lagos, we were tasked to set up an emergency operating center in a matter of 10 days or less. We were able to successfully achieve the task by pushing our teams to work very long hours, almost 20 hours a day sometimes, to set up for the facility from infrastructure, technology, internet, communications, everything, just the whole solution. This was achieved and had a huge impact on the success of the fight against Ebola. In concurrence with the setup of the EOC, our software team was also able to deploy a contact tracing app, which also had a lot of impact in tackling the outbreak.
After EHA's success in helping the government of Nigeria contain the Ebola virus disease outbreak, we were invited by several partners to bring this experience to fight the outbreak in other West African countries.
eHealth Africa supported the Polio Eradication Initiative in Nigeria by setting up emergency operations centers in 2014. Being an emergency management support organization that we are, eHealth Africa also played a significant role in the control of Ebola in Nigeria in 2014. By late 2014, eHealth Africa joined many other public health stakeholders to provide emergency management support to the Ebola outbreak in Guinea, Sierra Leone, and Liberia. With funding from CDC Foundation and Paul G. Allen, in 2015, these countries were declared Ebola-free. With a focus on health system strengthening, EHA continued to provide support through an award of a CDC cooperative agreement in Liberia and Sierra Leone for the next 3 years. With significant progress achieved in the region, our project closed and so did our country office in Liberia and a scale down of our Sierra Leone office.
After we supported the health systems in West Africa to end the Ebola virus outbreak, we focused on health system strengthening in Sierra Leone and Liberia to ensure that each country could start the journey to recovery and be better prepared for future public health emergencies. In Nigeria, we continue to work with polio eradication partners to introduce new strategies to increase the uptake of the polio vaccine.
Health camps is a project that I find very dear to my heart because it's the very first project that I started with at eHealth Africa. The Health Camp project is a project that was launched in 2014 in partnership with the state government in Kano, as well as some key stakeholders. Basically to provide and distribute, set up health camps, which EHA's major role is to distribute health camp boxes across the 44 LGAs of Kano. These health camp boxes contain essential medicines and drugs that were used to treat very common diseases that are found within the community. In 2015, eHealth Africa recorded a significant increase in the number of health camp boxes distributed across the 44 LGAs in Kano State. Also, in the same 2015, an exciting aspect of the business happened at EHA, and this is the movement from the old office, which is EHA's first office actually, to the permanent headquarter office located on Independence Road, where we currently are now.
Following the success of health camps in Kano State, the project was introduced in 7 local government areas of Borno State.
EHA's intervention in Borno State has been an exciting one. We got into Borno State in 2016 after the 4 cases of WFPV were discovered just at the point when Nigeria was expecting to be certified WPV-free. It was important to ascertain why those locations were possibly not visited, and also provide a means to verify that vaccination team members had reached every location they were supposed to reach. So EHA's intervention in Borno State has largely been around data management support and technical support even at the field level to help the state both plan, monitor and provide accountable feedback for activities carried out by vaccination team members. The major activities we provided around technology support and data management were deployment of vaccination tracking systems, which is a passive tracking application on Android devices carried by vaccination team members, and this helps us to identify locations where they have also reached. Now this also helped us make sure that there is a comprehensive master list of sediments that would help us effectively plan. So we also carried out data collection activities. In order to ensure that there is verifiable records and accountability for the coverage of vaccination team members, this geospatial information is provided back to the state. They use this for planning, they use this for monitoring, and they use this for providing feedback to the LGA teams, to the state teams, and to the national, in order to be sure that we are effectively planning and reaching children under 5 with polio vaccines. A few other milestones that we've achieved is about the support we provided for AFP surveillance and being able to map locations where AFP cases were reported and investigated, and that helped also plan and effectively track these cases while trying to achieve wild polio certification for Nigeria. It's proud to actually mention that the intervention in Borno State, especially the geospatial technology and data management support provided by EHA, have contributed effectively and enormously to the achievement of WPV certification in Nigeria.
EHA's strength is designing and deploying technology-driven solutions that are suited to the context in which we work. We are able to do this because our team consists of people who live in the communities we work in. We know that the secret to sustaining the gains we have recorded is to build local capacity to continue the work we have started.
I am currently the head of the engineering department at eHealth Africa. I joined EHA in 2015 as a consultant, and then changed role to software development, and then I'm finally here in the Nigerian office. So while in Guinea, one of the major projects that we had was the EHA Academy. So the EHA Academy is the 8 weeks program to build capacity in software development, GIS, software project management, as well as networking and database management. So for the first session of the academy in Guinea, we had about 30 participants. And out of those 30 participants, we selected 3 of the best candidates to join EHA as full-time software developers. And they went on to work in Guinea, Liberia, Sierra Leone, as well as Nigeria here. Because of the success of the first session in Guinea, we decided to replicate the same thing also in northern Nigeria, starting with Kano. So again, the objective is to really build capacity in software development and just enable the young population here to be able to either find jobs with EHA or just be able to build their own startup or join other organizations as software developers, either as data analysts or UI/UX designers.
In 2018, we continued to gather, collate, and analyze the data that enhanced planning and decision-making in health systems across West Africa. With first-hand knowledge of how data and technology were strengthening public health emergency management, health delivery, and disease surveillance systems in Africa, we began to explore other focus areas such as the nutrition and food security systems and laboratory and diagnostic systems. We expanded our portfolio with more projects in those focus areas and also delved into other priority diseases, including malaria, pneumonia, and meningitis, so that we could contribute more to addressing ongoing public health issues in the region. Our team did some award-winning work, and EHA was recognized for our work in building innovative solutions and delivering impactful projects. As a way to live our values, we created several events and platforms where we and our partner organizations could share our knowledge and expertise to build our communities and encourage local talent.
10 years at eHealth Africa has been an amazing journey. Over the last 10 years, we have provided the government and our key partners with access to real-time, geo-enabled data that has improved decision-making. One of the things that we're really proud of is being part of the team that has enabled the country to achieve polio-free certification in 2020. Looking forward into the future, we hope to continue to leverage the expertise and the innovations that we have gained in the polio eradication fight into other public health outcomes. We hope to continue to use the data and the infrastructure that we have established in fighting other critical diseases. And at the end of the day, we want to ensure that the underserved communities that we reach have better lives.
Our first 10 years have been full of rewarding experiences and great milestones. We are looking forward to another 10 years of strong partnerships, great experiences, and even bigger successes.